everyone, this is Sam and Emma from PodiPedia and we're going to talk to you today about shin pain.
Yes, shin pain, a really common thing that we see.
Yep.
Basically pain from anywhere from the ankle here up the front of the leg. Lift your leg up and shoulder in this area here.
Exactly.
Loads of patients come in and there are lots of things that can cause pain in this area. The most common one that sort of people ask us about, or probably the term that we hear, is shin splints. The medical name for shin splints really is medial tibial stress syndrome. So the tibia bone is a larger bone down here, and people sort of get tenderness down this area, commonly associated with running, sort of long distance running or walking.
Yeah, I normally see runners with this problem.
Definitely, yeah. Coming in training for a half marathon or a marathon and they're getting a load of pain or discomfort in the inside of the shin. If you run your thumb or fingers down there, it's really sharp.
Yeah.
I often find with medial tibial stress syndrome that when you start running, the pain can be there, but it can ease off a little bit.
It definitely calms down with a little bit of exercise.
Then comes back again
afterwards,
all the more you do.
Yeah.
So that's a really common one. Next sort of main one that we see is extensor tendon pain.
Yeah, so you have quite a few tendons running down the front of your shin. These are the tendons that are responsible for sort of crossing the ankle and dorsiflexing the foot, or basically bringing the foot upwards, exactly. And those tendons run down the front, and there's not much space in the front of the tibial region, so they can get quite sore where they cross the ankle, particularly under what's called the retinaculum, which is sort of a bit like a seatbelt across the front of the ankle. I'll just borrow something, my lovely assistant here. So it runs across here, and you can get really nasty pain where that happens, and that, again, that's usually overuse, too much walking downhill.
Yeah. Bad footwear, certainly heels or very flat shoes.
Yeah.
Spending a lot of time on your feet can really aggravate them. So the extensor tendons, some of them run down into the toes. You have your tibialis anterior as well, which is a muscle in the inside of the shin, which turns into a tendon and connects to the foot around this sort of area. So that's another common one we can see people get problems in. And certainly another key one is compartment syndrome, which is basically swelling and pain around the front of the shin.
And there is another video all devoted to compartment syndrome, so check that out on our website if you want to.
Yeah, on podipedia.co.uk there is an individual page for each of these conditions with more information. So this is kind of a general overview of shin pain, but have a look at each of the conditions to see which symptoms relate more to you and specifically what you can sort of do with them. Yeah. The other one I see is high ankle sprains, I suppose, in this area.
Yeah, it's
less common.
Yeah, much less common, and it's more of an acute injury. It's quite a difficult sprain to have.
A ligament runs between these two bones.
Yeah, exactly. There's an interosseous ligament here that joins the tibia and the fibula together, and sometimes you can sprain that. It's quite an unusual one.
Sports injury, twisting.
It's more so than I see. So the point is with all of those things, though, to help yourself, you need to listen to your body and try and rest. Undo the injury. If you've been doing something that's aggravated it, stop doing that activity, let it calm down. Use ice therapy if you find that helpful. Use some appropriate painkillers if appropriate, of course. But if it's not going away, what's the best thing for people to do?
Go and get assessment. See a podiatrist. Go to the PodiPedia website, have a look in the directory and find a podiatrist near to you who can further assess this. I think, going back to the point of treatment, activity modification is key.
Really
these things tend to come on when people increase activities, or maybe changing footwear. If you've changed footwear for work or changed footwear for running or different things, then basically that could be putting more stress through the soft tissues or through the shin, tibia bone itself, and causing these symptoms as well. Regarding ice therapy and anti-inflammatory or pain relieving medication, there's information about this on the PodiPedia website as well, so have a good read of that just for your safety. And basically, I think that's about it with shin pain, isn't it?
Indeed, yes. So if you want help, you can go to podipedia.co.uk and find yourself an HCPC registered podiatrist who can help you locally to you.
If you like this video, hit subscribe. There'll be more content coming in the future.